I was a primary care provider, and I really loved it, but I wanted to be more hands-on with my patients. And I actually used to work with Dr. Weitzman years ago, and saw that he was hiring. And I thought, oh, that could be so fun, working with lasers and making people feel good about themselves, and being with patients who aren't sick all the time and they're happy and they want to be here. So that's kind of what brought me here.
I started out doing emergency medicine, which I loved. And I realized that I also loved family medicine. I went back to residency for family medicine. And I was on faculty at UMass in Worcester. And I read an article in a journal about laser tattoo removal, and that sparked this interest in aesthetic medicine, and it just blossomed from there.
So we do lots of things with lots of different lasers. So we have some of the most common ones are laser hair removal. We have a vascular laser, so different types of red marks, birthmarks, things like that, rosacea. We do tattoo removal. We treat survivors of violence who have had traumatic tattoos, or cancer survivors who have radiation tattoos. So we're part of different programs in that regard. We do injectables, so things like Botox and fillers. We have an esthetician who does skin care. I could go on and on.
When I looked at ways to incorporate laser medicine, aesthetic medicine, it didn't seem to fit into my primary care. I was working in a larger group, and after talking with a lot of people, it made sense to have a separate practice which could be devoted to laser and aesthetic medicine. And that seems to have worked out very well.
I don't think people quite know just how many things we can do for them, and that it can be within their budget. I think a lot of people think that anytime they're going to do any sort of treatments on themselves, that it could be crazy expensive, or it can look really fake or inappropriate. And we really care about patients as a whole, and making them happy and making them feel good about themselves and looking natural, and so they don't have to look kind of crazy like the media portrays them as looking. So we have tons of different services that can fit their needs and their budget.
When I started this, Amherst had very few other providers offering this type of service, and it was close to my home, close to where my primary practice was, and it seemed like a great place. Amherst is a great town.
Our backgrounds are all primary care. So we have a physician who runs the practice and nurse practitioners. We're not techs running machines, no offense to techs, we love them, but we have degrees, and we see patients from a larger perspective, as in our background in primary care. So we can kind of see different things that are maybe contributing to what's going on and what brings them in, and not just focus on the aesthetics piece of things.
One of the things I like about aesthetic medicine is most people are happy. Most people generally feel good. They just want to feel better. They're not as sick as primary care people. So for many years, there was a balance. I enjoyed doing primary care. It was a little harder in many ways. Dealing with people who are happy and excited is fun. And over time, we were getting busier and busier, and then I transitioned out of primary care, and I'm doing this full time.
We were working with Northampton. There's a facility there for it's the community health center for trans patients. They were actually referring a lot of patients to us, so we do a lot of laser hair removal for them in preparation for different surgeries that they may do to help them feel more themselves.
We want to be a good community member, and we want to brighten up Amherst Day, and we have a beautiful garden that I think brightens up Amherst Day. We want to offer good services that are more reasonably priced than people might realize elsewhere. I think more than anything, we want to be, good community members.
We're part of what's called New Beginnings. And basically all that means is that we'll treat patients pro bono for any radiation tattoos that they've sustained throughout their treatment. So we'll cover the cost for as many treatments as they need until the marks are gone.
There's a lot of need that this community has in terms of laser hair removal in particular. And for the most part, insurances do not cover that service. And I felt that insurance should cover it. What we decided as a group is that we would give this community a 50% discount on laser hair removal services, because we felt that was the right thing to do as a societal gesture. And we worked with the UMass Center, and we worked with some other primary care practices that focused on LGBTQ communities, and we've developed a fairly large client base, and it's worked out for us, and I think it's worked out for the community as well.
So we are almost exclusively selling SkinCeuticals products. We really like their products because they're backed by science. So they have a lot of studies that show the efficacy and just sort of the way that the products work on patients. And so we really like that. Our esthetician is really involved in the SkinCeuticals side of things. So she's a great knowledge base. But we have a lot of mostly skincare products, so face washes, moisturizers, vitamin C's, retinols, a lot of those types of things here.
I think many people are surprised that we offer services that are much more reasonably priced than they may read about or hear about. And I also want to reiterate that we really do want to focus on a more natural look rather than a overly artificial look. So I think people are surprised and pleasantly surprised about that.